Hello, my name is Mark DiTomaso. Dr. Haig was kind enough to ask me to make this video because I have 14 years of caregiving experience for my mother. 6 of those years were nonstop, round-the-clock caregiving, and I want to talk to you about both the insights I gained regarding the patient and regarding the caregiver, the burnout you could experience, the hopelessness, a whole slew of emotions and dynamics that I want to share with you to at least spark the conversation and give you something to think about. No profession can fully prepare you for everything. There are some things that only come through experience, and I want to hopefully share some of those more intricate insights that I've gained. Hopefully it will benefit you to become the caregiver if you choose this profession. The type of caregiver that will be able to take care of themselves as well as they take care of the patient. That's the trick. Many caregivers burn out and die before their patients do. That's just a fact, a reality of what you're up against as a caregiver. Now, there's a difference between somebody like myself who cared for a family member. The motivations, the dynamics, the options are limited as compared to a professional caregiver who has the training of institutional training, and if you work for a hospital, you have the support, you have days off, you have protocol to follow, systems in place to kind of check your performance and how you're holding up. And those are important, but they may not be totally sufficient. The field is growing, and medicine changes over the years. The dynamics, our policies change, what is available to the patient changes, and unfortunately the caregiver is left many times to just tough it out or figure things out on their own. So that's the purpose of me approaching Dr. Haig and offering to share some of the insights that I found, because unfortunately some of the care provided by our systems, hospitals, nursing homes, are very, very strained. No fault really on the caregiver. They're just forced into a position where they lack resources. They're overworked, understaffed, and some of the changes a caregiver will go through are pretty dramatic. Like I said, for a family member, the dynamics are different, and oftentimes that leads to the whole disruption of the whole family system. And we'll get to that later. But right now I want to focus on patient care and the things that I think are most important to the patient from their perspective. Number one, mainly dignity and respect. The elder patient, was once young, probably very productive, maybe dynamic. The thing is that as you age, you lose the ability to do the things you loved and the things that you identified with. And it's a very challenging place for an older person to let go of being able to cook, being able to host or recall things in conversation. Challenges their sense of self in many, many ways. So being respectful to your patient as in lending your patience, and having empathy are among the most important things I could stress. that are important to the patient. So when you handle them gently, when you speak gently to them, it makes a huge difference on how they're experiencing their care. Another thing that may not seem very important, but I can tell you that it's important to the patient, is to have company during mealtime. Having to hurry up and finish your meal when you're the one facing these changes, it makes you feel less significant, and it is something that I stress to keep in mind, that the patient's emotions have a lot to do with their ability to recover, with their ability to follow a treatment plan. Their emotions are paramount. So try to find ways to laugh with them and be grateful for their presence. When you can bolster somebody's appreciation for themselves so that they don't feel that they're a burden, this is a very important aspect of caregiving. At the same time, a caregiver can be run ragged, and you have to be able to set boundaries for the patient's sake and your own. To be able to say no when you want to say yes, to be able to limit the amount of time maybe that a patient exercises, or what they ask of you. You have to be able to say no. So that's important too. As far as the patient is concerned, always keep in mind, their modesty, their sense of self, as to not embarrass them. Elder people, patients there are reliant, dependent on the caregiver, and it is really hard for somebody who's been self-sufficient their entire life to get used to. So another thing is that always be mindful of their pride, how they dress, that they feel comfortable and presentable. It helps with their self-esteem and their self-image. Another thing that institutions may not fully prepare you for are the family dynamics that influence how the patient responds to care. Some patients in elder care homes haven't seen their family members in months, sometimes even years, and that can really complicate the patient's state of mind, their emotional state, their appetite, how much energy they have and how much energy they want to put towards healing. And as a caregiver, you can be very frustrated when you know somebody has it in them and you can't see why they're not participating, or you don't understand why they're not eating. Well, emotions have a very large part in all of those things. So the patient themselves, you'll be caregiving in an institution, I'm assuming, for people with a variety of conditions. Some need a little bit of help, a little bit of assistance, and some are totally dependent on you for even the most basic needs in your life. So I'm sure that your professors will educate you as to the severity of your patient's needs, but I'm telling you that you have to be ready to go from a very normal or light responsibility with one patient, very cooperative, and then have somebody else who may be facing excruciating pain and the heavy dynamics of having to let go. So I mention that for your sake, the caregiver's sake, because whether it's a family member or just a patient, the caregiver can get very emotionally attached. And that has a cumulative effect on the caregiver. So you want to have systems in place for you to be able to keep things in perspective and not let it overwhelm you. So again, a variety of conditions, personality types, physical abilities, and communication abilities. Sometimes cultural dynamics will get in the way. And it may be frustrating for you, but again, your job is to look out for the care and comfort of the patient and be aware of these dynamics, these cultural dynamics. As a caregiver, for somebody at home, you're in charge of the medications, the dosage, the timing, doctor's appointments. You know, you are the liaison between the doctors and the nurses, and too many times there are gaps in that chain. So it's up to you to be able to monitor and make sure that what is communicated is essential, and that we're not leaving out important things, especially when it comes to medication. I would suggest, if you're caring for somebody at home, in their home, to set up the home, to have first aid kits ready, filled, and close by if you can. Have maybe one in the bedroom if that's where the patient spends the majority of their time, have another in the kitchen, or as close by to where you spend the majority of your time is important, because sometimes, you know, the patient is losing consciousness or dizzy, and you can't be in two places at once. So you try to think ahead as much as possible. For the patient, personal hygiene is very important and can lead to infections and complicate their condition, end up in a hospital. I can't tell you how many times Mom ended up in the hospital because she was dehydrated, or her urinary tract infection. That was a major consideration, and is a major consideration with many elderly women. They're very prone to urinary tract infections, and this can get very serious. It can advance to a place where it's very hard to keep up with antibiotics. And well, I'll leave that to the doctors to educate you further on that. But I was there with my mother, and at one point they had her in the hospital in a special wing because it was very severe, the urinary tract infection, and dangerous to others. So it's something that you want to take very seriously. Again, to be aware of their dietary needs and preferences is very important. You know, they can't enjoy as much as they used to. So the meals, the company, how they're treated is super important. So again, with the patient, you have their physical needs, their mental, their emotional needs. Their sense of autonomy is crucial to be able to help them maintain the ability to do as much and engage in life as much as possible. This is very valuable. Their self-worth, their dignity, their sense of respect, that their sense of being able to contribute to the world, even if it's only you acknowledging their wisdom or their courage, that's a contribution, and let them know how it helps you. Do anything you can to reinforce, the self-worth of the patient, because it's hard to let go of your abilities and hard to let go. That they feel important and valued is crucial. So if you can do those things as a caregiver, you're fulfilling a very important role. As far as your role as a caregiver, you have your job description. You have things that you need to show competence and mastery over. There are ways to measure your performance. what is important to keep track of are your expectations for this career and where you expect to be 5 years ahead, and keep track of that, because it may change as you advance. You may find out that you may have bitten off more than you chew, or that you're ready to move on to something else, and that's okay. Our intentions going into a profession are often very different than they are a few years into them. Our understanding of the profession more clearly. So it's important to allow yourself the possibility that you may find another career path suits you best, because your career, whatever it is, will affect your finances. It'll affect your family relationships. You want to be aware of how much stress you carry and, for lack of a better term, leak out onto other people. It can create friction within your fellow employees when you carry stress that you don't process and come to terms with. So something else to be very mindful of. As a caregiver, it can deplete your energy. You need to be able to ask for help when you need it and set boundaries yourself as needed, because your self-care is primary. If you don't take care of yourself, you can't take care of anybody else. Your patient, your family suffers, your relationships suffer. So you want to be aware of the way that your profession affects the rest of your life, and you want to be mindful that you're getting the support you need from the other areas of your life to support your career. So all these things are connected, and it's hard to keep track of. Usually at work, they only track your performance, and they don't see, they're not concerned so much with your private life and what's going on in your life. That's up to you to manage, so that when you come to work, you could perform at your best. But it is, in my opinion, is sorely lacking the type of support materials that are related to burnout. So I took that upon myself to create a system that'll help the caregiver from deteriorating, because after 14 years of caregiving for my mother, there was a point where I sought help for severe depression. I felt trapped. I felt that nobody understood what was going on with me, that everything was falling on my shoulders. Again, I was a caregiver in a family situation, not as a professional. As a professional, I would urge you to make sure that your superiors, your work environment has those protections in place for you, and acknowledge your needs as much as their own. Facilities need shifts filled, and sometimes they take advantage of the employee who keeps giving and giving and giving, and they praise them, perhaps without knowing the toll that it's taking on that patient, on that employee. So it's up to the employee to have a good sense of how they're functioning, if it's harmonizing with the rest of their life or not. So that's why I developed the materials that I have. So quickly, I will let you know that you could find the Resilience Codex, How to Turn Crisis into Consciousness. You could find this on Amazon or on my website. But it's adaptable. So the Resilience Codex shows you my I share with you my understanding, my method of reinforcing myself so I could withstand the pressures that were associated with caregiving and regain my agency. I had cancer, I had severe depression, and I recovered from those. I have spinal degeneration, which is an ongoing concern of mine. Your employers won't necessarily take into account how these things are affecting your health. It's up to you to manage them so that you can continue with your profession and operate at the highest levels. For family caregivers, a whole different set of dynamics are involved because there is no structure, no protocol, no rules as far as like a hospital would have. And the family dynamics, whatever underlying dynamics, whatever is under the surface will surface as you go through the caregiving process, as the caregiver goes through those changes and experiences those changes. If the rest of the family doesn't understand the dynamics, that caregiver is left on their own, and it could lead to ruin, and it could lead to court cases where the family is really at each other's throats over the wrong things, where if they deal with them in advance, just talking about these dynamics takes much of the pressure out of the dynamics so that it's easier to manage. So this is why I created this book, the End of Life Wisdom Workbook, that helps you prepare for what you may be getting into. It gives you scripts and prompts for the family members to discuss distributing the responsibilities evenly. Not everybody has the same capacity, but together, if the family works at it, they could find a much more manageable way of sustaining both the caregiver and the level of care for the parent or loved one. Whereas if you don't talk about these things, people kind of put their heads in the sand and come up with, you should have done this, you should have done that, to the caregiver when they have no idea what the caregiver is going through. I have a personal friend who's experiencing this now. He's been married 45 years. He's taking care of his mother at his home, but it's tearing his family apart. And that's a shame because they've been together for over 40 years. This particular couple survived the loss of a child, but now the strain of caring for a parent is tearing their family apart after all these years, and that's just a terrible tragedy. It doesn't have to be that way. Talking about the dynamics involved can take out 80% of the charge that makes these dynamics difficult. So the End of Life Wisdom Workbook, I'm trying to get it into hospice, to license it to hospice, because many times their caregivers burn out. The costs associated with training a new nurse are tremendous, and good people get burnt out when they don't have to. Families suffer in ways when they don't have to. So that's the value of the End of Life Wisdom Workbook. This, again, is available on Amazon. Talk to Dr. Haig. I'll give you a student discount. For burnout particularly, I developed the Crush Stress Protocol, which takes you approximately 20 minutes to learn, 2 minutes to practice in the field. And it's a tool, a system that you could use for the rest of your life. This is specifically made for first responders and caregivers who have firefighters have among the highest rates of suicide related to their profession, the strain of their profession. I personally have lost several friends who were firefighters, 3 of them over my lifetime, died way too young. And there is something we can do about it. So in the crush stress protocol, I give you techniques to keep things in perspective, to process the shock, the vicarious stress, other people's stress that we carry, primarily the moral damage that we suffer when we witness suffering on somebody else's part that we can't do anything about. Moral injury, it can be mitigated if it's recognized. Too often in our fire departments and our police departments in the military, we're told to tough it out, to manage whatever you got to manage, pray harder. Real men, can take it, and that's just not the truth. I've known so many real men, heroes in my eyes, who've just, they burn out. And it's a terrible shame. So, dealing with your stress is crucial to your job performance. It's also critical to the rest of your life, your finances, your family life, your relationships. And God forbid you get burnt out to the point of exhaustion and you start taking shortcuts or not realizing the impact of your behavior. I know what it's like to get to the point where you feel like nobody cares about you and you start to not care yourself. And that's a terrible place to be. Nobody should end up there, especially when they're giving of themselves for the benefit of others. So it's something to be very, very mindful of, your level of stress, how you're handling the weight of your situation. Like many people, especially men my age, you feel like you just keep going. You do what has to be done. I went through years of sleepless nights with mom. As a single dad, same thing. Working as many jobs as you need to work to make the bills, to keep your responsibilities. And if you are overburdening yourself, it's like driving a car when you're tired. All it takes is one time when you're not off and veer into the other lane, you could end up in a head-on collision that not only affects your life, but it affects the lives of others that you had no intention of harming. So burnout is something very, very real and something we need to stay on top of. Hopefully my Resilience Codex and the Crush Stress Protocol will help you to avoid those types of catastrophes. So I hope this video helped you. I know, I'm not an actor. There was no script. I come from the heart. Again, let me thank you for considering this profession. It's very important, and as our society ages, I'm getting closer and closer to that stage where I'm going to need care from somebody else as well. Fortunately, I can still manage my life at this point, but that time comes for all of us. And whether you're the caregiver, whether you know somebody who's a caregiver or know somebody who's receiving care, I hope this video will enlighten you as to some of the things to be aware of. So thank you very much for your time. Thank you, Dr. Haig, and good luck to all of you.